Hi, this is Josh with PharmacistTips.com to tell you about the medication Pregabalin. I'm going to discuss Pregabalin in today's video. The specific topics we're going to cover about this: what is Pregabalin, some of the common uses, what is the dosage. We're going to talk specifically about Pregabalin for anxiety, some of the most common side effects, some other side effects, warnings, and withdrawals associated with this medication. As with all my videos, this is for informational purposes only. It is not intended to serve as a substitute for consultation, diagnosis, and or treatment of a qualified physician or healthcare provider. So what is Pregabalin? In the US, it's sold under the brand name Lyrica and Lyrica CR. It's what's known as a GABA analog. GABA analog. It's an anticonvulsant, so used to treat seizures, and it has a calming effect on the nerves. That's what I tell people in the pharmacy. So it is an anticonvulsant, but by far the most common use is for nerve pain, nerve-associated discomfort issues, things like that. In the U.S. market, it's available in 25, 50, 75, 100, 150, 225, and 300 milligram capsules. So a lot of flexibility in the dosing on this one. Uses, we see it used for fibromyalgia, nerve pain, so we touched on that just a bit. Nerve pain like diabetic nerve pain or spinal cord injury, we see it used for that. Residual shingles pain, so if somebody's had shingles, of course shingles is happens along the nerve, so there can be a lot of nerve pain both during and after. And of course we touched on seizures. It can be used for seizures as well. Over time, we found some off-label uses. Off-label meaning it was not studied for this, but we have found it helps with these conditions over time. Chronic cough, anxiety, post-operative pain, so right after a procedure. Every now and then, we sometimes see people take one prior to the procedure, and that can help control the pain afterwards. Itching, so chronic itching, sometimes it's used for that. Restless leg syndrome and menopause symptoms, especially some of the more severe symptoms. So dosage of course is variable. Typically you start on the lower end, 25 to 150 per day, usually split up, but sometimes that is started at bedtime. Because drowsiness being one of the most common side effects. Sometimes people get used to it best if they start with it at bedtime and slowly increase the dose from there. Of course, your doctor will help you determine the way that they're going to go ahead and start you on that. Usually the dose is increased at weekly intervals if needed. If the starting dose is not enough, it's often increased every week. Max dose range, usually the 300 to 600 milligrams per day. So anxiety, I'm going to just talk about that a little more here. It's an off-label use. So it was not studied for that. It's not been approved for use in anxiety. So some physicians, some healthcare providers may not feel comfortable using it for this purpose. It is a growing interest for this medicine for anxiety. The doses in the small study is usually around 100 milligrams 3 times a day. Want to increase that very slowly, and then of course the maximum dose 600 milligrams a day. This is not going to be the perfect solution for everybody, but we are seeing a growing interest in using it for anxiety. Most common side effects: peripheral edema, so swelling or puffiness, like you're retaining fluid, can occur up to 16% of people. Oftentimes these side effects are dose dependent too, so if you're on the lower end of dosing, that does typically reduce the chance of side effects. Dizziness, drowsiness, fatigue, those are the big ones. Many people will get used to those as they're on this medication longer. Some people simply can't get over those, and they may not be a candidate for using Pregabalin. Weight gain can occur in 2 to 14% of people. Dry mouth, 1 out of 10 could have some dried mouth. Same with blurred vision, 1 in 10 could have some issues with blurred vision. Other side effects can include confusion, constipation, euphoria. Unfortunately, we see some people abuse this medicine at higher doses. It can have a euphoric sensation. Certainly, that's not what we want to see this used for. reduced coordination. So you need to be very careful with driving, things that require you to be alert and have your coordination intact. It can increase appetite. That's where we can see some of the weight gain. It can affect blood pressure, muscle spasms, tremor, vomiting, feeling intoxicated, can really cause some memory issues, and other side effects can occur as well. So the warnings, we've kind of touched on some of these and the side effects. Angioedema, extremely rare, but it's a swelling in the face, throat, neck, tongue. It can be very scary, and it can be a medical emergency. Extremely rare, but if that does happen, we need to seek medical attention right away. Risk of suicidal ideation. That is a very, very low risk, but if you notice your thoughts going in that direction, please seek medical attention. Peripheral edema, we talked about that in the side effects, of course, swelling, puffiness, weight gain, withdrawal. This medication, you slowly increase the dose, and then you can't just stop the dose comfortably. Many people do need to slowly reduce that dose. We'll touch on that more in just a moment. Cause some vision issues, rhabdomyolysis, that's an extremely rare issue with muscle breakdown, very, very rare. Caution with poor kidney function. If your kidneys are not operating at full capacity, the dose may need to be reduced. And the potential for abuse, we've touched on that a little. This medicine can be abused. So withdrawal. Usually the dose is going to be tapered to prevent those withdrawal symptoms. Withdrawal symptoms include anxiety, insomnia, nausea, sweating, of course, pain, irritability, agitation, heart palpitations, diarrhea, headache, flu-like symptoms, seizures, blood pressure changes, all potential problems if you were to stop this medication cold turkey, especially depending on the dose that you've been on. Typically, minimum taper is 1 week, but depending on the dose and how long you've been on it, some people need to be tapered over weeks or even months, so they don't have all the uncomfortable withdrawal symptoms. That's something you and your healthcare provider can figure out. Appreciate you watching this video. Go ahead and ask questions in the comments below. If there is something about this medication I didn't cover in the video and you'd like to know, I would appreciate it if you subscribe to my channel. Thanks for watching.